This education module will explain the principles of limb lengthening using the lower leg as the example. The limb lengthening process involves two steps. Initially, you will need an operation to put the external frame onto your leg and to divide the leg bones. In the weeks to months following the operation, your leg will then be lengthened using the frame. The lower leg consists of two bones, the tibia or shin bone and the fibula. Most of the body weight goes through the tibia. Both bones will be lengthened, but the tibia is the more important of the two. The fibula acts as a support for the muscles and the ankle joint. Around the bone are soft tissues that include skin, muscle, nerve, and blood vessels. We will start by explaining the details of the operation. You will have an anesthetic, which means you will be asleep for the entire procedure. A number of small incisions will then be made over the shin, so that metal pins can be screwed into your shin bone. The external frame is then attached to these pins. The frame has a threaded bar which will later be used to adjust its length, and hence the length of the bone. A screw is then inserted between the tibia and fibula near the ankle. This helps to strengthen the ankle joint during the lengthening process. To lengthen the bones, they must first be divided surgically. A small skin incision is made over each bone, and they are divided. The external frame then holds the tibia in place, keeping the ends together. Finally, the wounds are closed and dressings are applied. The stay in hospital is usually for about 3 to 4 days. Applying the frame and dividing the bone will result in some pain and swelling in the leg. You will be given painkillers to make you comfortable. Swelling can be reduced by raising the leg on pillows and performing exercises. Using your leg is very important to ensure a good outcome. You will be allowed to go home when you are mobile enough. During the entire lengthening process, it is important to prevent your ankle and knee from becoming stiff. Early on, you will be taught exercises and how to position your leg. Your ankle is also likely to be kept in a good position using an elasticized bandage or a foot plate. This splinting is likely to continue for much of your treatment. After a couple of days, once the pain and swelling are under control, the physiotherapist will teach you to walk with the help of a frame or crutches. Using your leg is very important to ensure a good outcome. You will be allowed to go home when you are mobile enough. Leg lengthening is a long and complex process. The operation is only the starting point to prepare your leg for the lengthening process. Lengthening will not start until about 1 week after the operation. This initial wait allows the healing process to begin, with new bones starting to form where the bones were divided. You will be lengthening your own leg by turning the threaded bar on the frame. This pushes the frame clamps apart, removing the bone ends slowly away from each other. For as long as you continue to separate the bone ends, new bone will form. The soft tissues around the bone will lengthen and grow with the bone lengthening. And this stretching can cause pain and stiffness if not managed properly. X-rays will be performed periodically to monitor the lengthening process. On average, your leg will be lengthened at a rate of around 1 millimeter per day in small, divided amounts. Depending on the appearance of the new bone, you may need to speed up or slow down the rate of your lengthening. Your surgical team will instruct you at each clinic visit what to do. Once the desired length is reached, lengthening is stopped, and the frame is locked in this position. At this stage, the new bone is still soft and requires the frame to support the leg. Over the following months, the healing process finishes, with the new bone becoming progressively harder and more like normal bone. The frame will be removed when your bone is hard enough. While it is not possible to predict how long each person requires the frame, it takes roughly 1 to 2 months for every centimetre of length required. For example, if you need 5 centimetres of lengthening, you should expect to wear a frame for between 5 to 10 months. Frame removal can be performed either in the clinic or in the operating theatre under a general anaesthetic. It is vital to understand that the leg lengthening process does not finish when the frame comes off. Your leg muscles and bones will be weak for some months after the frame is removed. In order to strengthen them, you will need to continue your exercises for many months. During this time, you will need to protect your bones, as they will fracture more easily. For most people, this simply means avoiding excessive activities, like sports, for a number of months. Others may need to use crutches, and some may need to wear a lightweight cast or plastic brace for a number of weeks. During the leg lengthening process, there are a number of things you will be required to do to ensure a good outcome. Daily frame adjustment, care for the frame and pin sites, exercise and physiotherapy, attend clinic appointments. While your medical team will closely follow your progress, you will actually be the one lengthening your leg. You will need to turn the threaded rod on your frame every day while lengthening. How much you need to turn the threaded rod each day depends on the progress of your new bone. Your surgeon and others in your medical team will discuss this with you during your regular clinic appointments. During the entire lengthening, you will be wearing the frame which is attached to your tibia by metal pins. The skin at these pin sites can become irritated and, on occasion, infected. They will need to be regularly inspected and cared for. You will also need to keep your frame clean and dry, which may make bathing or showering more difficult. Your medical team will teach you how to do these tasks. Exercise and physiotherapy are very important during leg lengthening for 2 reasons. Firstly, they help to stimulate the tissues in the leg to grow. Secondly, they help to keep your joints moving freely, preventing stiffness, which we will discuss later. Your physiotherapist will tailor an exercise program for you. Regularly performing these exercises will not only speed your recovery, but is crucial to a good outcome. During leg lengthening, it is critical that your progress is reviewed regularly by your medical team. This will include an X-ray and an examination of your leg. The state of the new bone and your soft tissues will determine the speed at which you lengthen the leg. Failing to attend regular follow-up appointments to monitor your progress can cause the leg lengthening to fail. It is important to realize that this leg lengthening process will have a significant impact on your life. Some of the difficulties arise from having to wear an external frame for many months. Others are a result of the body responding to the lengthening process. Because of the long periods of time involved, it is important to consider how this may affect you in the following ways: pain, stiffness, clothing, changes in the leg. Pain during lengthening comes mainly from stretching the soft tissues, and this will persist for as long as these soft tissues are being lengthened. After surgery, the initial pain improves but recurs once lengthening starts. It is for this reason that all patients undergoing limb lengthening have a good pain management plan in place and understand how to use their medications effectively. In addition to pain, anxiety, depression, and difficulty sleeping are often seen, along with a tendency to lose weight. It is extremely important to prevent excessive stiffness, as this can lead to joint damage, delay frame removal, or leave a permanent limb deformity. The best way to prevent stiffness is stretching the right muscles before surgery, positioning the leg correctly whilst resting, performing exercises and stretches during lengthening, managing pain well, using the leg as normally as possible. The frame will make it difficult to wear some types of clothing. You will need to consider either wearing baggier clothes, such as tracksuit pants, or modifying your current clothing with Velcro. Stretching of the skin, muscles, nerves, and blood vessels during lengthening usually has noticeable effects on your leg. It is likely to swell, and the skin is likely to get hairier. The sensation in your leg may be altered. The leg itself will probably feel tight, and you will notice that the leg is weaker. These changes are all usually temporary, settling down once the treatment is complete. All of these factors need to be considered when deciding to undertake a leg lengthening. For most people, this process is very successful at lengthening their leg. However, it is important to know that there are a number of limitations. This is not an exact process, so while your legs will be similar lengths, they may not be precisely equal. There is a limit on how much a leg can be lengthened at a time without greatly increasing the risk of complications. For people whose leg is not just shorter, but also smaller, lengthening will not alter the girth of the leg or the size of the foot. People whose leg is short at both the thigh and lower leg may end up with their knees at different levels. Children who are still growing sometimes need a further leg lengthening at a later date. Unfortunately, for a small number of people, this process does not achieve the desired lengthening, and it may actually leave them with different problems. While some things make it more likely that you will have a bad result, such as smoking or not exercising your leg, there is no certain way to predict who will have a good result and who will not. Scarring is an unavoidable consequence of having a leg lengthening. There will be scars from where the two leg bones are divided, and scars from where the frame pins go through the skin. After the frame is removed, the pin site scars may be stuck down on the tissues below, which can look unsightly. Although their appearance can be improved surgically at a later date, most patients do not request this. There are many possible complications when having a leg lengthening. It is impossible to discuss or even foresee every possible complication, so we will cover the common and the severe ones. If you are interested in knowing more about the possible complications, you must ask your surgeon. These are the possible complications we're going to cover: compartment syndrome, blood vessel injury, nerve injury, infection, blood clots, joint problems, poor bone growth, bone deformity, fracture after removal of frame, failure to reach desired length, chronic regional pain syndrome, CRPS, other medical complications. Excessive leg swelling in the first few days after the operation can increase the pressure in the leg, cutting off its blood supply. This is known as a compartment syndrome. It only occurs in a few people, but it requires urgent treatment to relieve the pressure. The skin and soft tissues are opened the whole way down the leg. These wounds will be left open until the swelling has settled. Closing the wounds is usually done over several operations, and sometimes may require a skin graft. Rarely, a major blood vessel is damaged during the operation. This is very serious, as it can reduce the blood flow to the leg. An urgent operation to repair the blood vessel may be necessary. In the event that it cannot be repaired, the leg may need to be amputated. The risk of amputation is extremely small. Although very unlikely, a major nerve may be damaged during the operation. This may result in numbness in the leg or foot. It can also weaken or paralyze the muscles of the leg. Sometimes an operation is performed to examine the injured nerve. While most nerve injuries are temporary, it is possible that damage could result in permanent disability. Nerves can also be injured as they are stretched during the lengthening process. This can usually be relieved by stopping the lengthening, but sometimes an operation to free up the nerve is performed. Infections can occur at two places: at the site where the bone is divided and at the pin sites. The risk of an infection of the wound is low. If this happens, you will stay in hospital longer and need antibiotics. Infection around a pin site is a common complication. Most of these are minor. The skin around the pin becomes red, painful, and may weep. It usually settles after taking oral antibiotics. However, sometimes admission to hospital for intravenous antibiotics is required. If a pin site infection persists, the pin may have to be removed and a new pin inserted nearby. There is always a chance of a wound infection or pin site infection spreading to the bone. Although the chance of this occurring is very small, it is more serious and may lead to long-term infection of the bone. Treatment includes admission to hospital, surgery, and strong antibiotics for 6 weeks or more. In extreme cases, lengthening may have to be abandoned. Blood clots can form in the legs after any operation. The risk can be lowered by various methods, such as blood thinning drugs. The chance of developing a blood clot during leg lengthening is low. While most people recover from a blood clot with treatment, sometimes the affected leg can remain permanently swollen. Rarely, a blood clot moves from the legs up into the lungs. This usually causes temporary breathing problems. Very rarely, it can be fatal. During leg lengthening, it is important that the muscles be lengthened just as much as the bones. If the muscles do not lengthen sufficiently, then you will not be able to straighten your knee or ankle joints. When a muscle is abnormally shortened, we say it has a contracture. The risk of developing a contracture can be minimized by rigorously following your exercise program. Despite this, a few people will still be left with a contracture that will affect the way they walk. While a contracture can be improved by a second operation, there is no guarantee that movement and strength can be returned to normal. Occasionally, shortened muscles can start to pull the bones out of joint. If this happens, lengthening may have to be abandoned, or you may need a further operation to support the affected joint. Your body makes new bone in your leg during the lengthening process. The growth of this new bone is affected by many things. Whilst exercise and physiotherapy help to stimulate bone growth, some anti-inflammatory medications like aspirin can slow down the bone growth. Smoking is particularly bad for new bone growth because it damages the blood supply. Therefore, it is essential that you do not smoke while having your leg lengthened. Leg deformity can occur either before or after the frame is removed. Sometimes, during lengthening, the stretched muscles pull unevenly on the bone. If the frame is not strong enough to resist this, the bone will bend, resulting in a deformity. This is usually so small that it is unnoticeable. However, in some cases, a deformity can be large enough to need treatment. The frame may need to be adjusted or replaced at a second operation. Judging when your new bone is strong enough to allow removal of the frame can be difficult for your surgeon. Sometimes, despite appearing to be hard enough, the new bone can bend or shorten after the frame is removed. Again, this is usually unnoticeable. Rarely, the deformity is severe enough to require a plaster cast, or in extreme cases, reattachment of a frame. Fracture after removal of frame. There is a moderate risk of breaking your leg after the frame comes off. However, this risk will be increased if you have developed a contracture during the treatment. When the external frame is removed, the whole bone is relatively weak and more likely to break than usual. While fractures or breaks can occur anywhere in the bone, the new bone and pinholes are particularly weak spots. Treatment of a fracture may require a cast or an operation to reattach a frame. Avoidance of fracturing your leg at this late stage in the process is vital. As previously mentioned, the bone must be protected until it has regained its full strength. In a few people, complications during lengthening may make it necessary to stop the lengthening process. In these cases, the leg will not get to the desired length. A few patients having a leg lengthening develop chronic regional pain syndrome, CRPS. People who get CRPS develop a very painful, swollen, and stiff leg. The severity of symptoms and duration can vary greatly. Treatment may include extra physiotherapy, strong painkillers, and even injections around the nerves. It may result in some permanent disability. With any operation, there are possible medical complications. These include anesthetic problems, heart-related problems, urine retention, chest infections, and allergic reactions to drugs. While most of these are easily treated, they can all lead to a slower recovery after the operation and a longer stay in hospital for treatment. Rarely, these medical complications can leave you with permanent problems, and in the worst cases, they can even be fatal. Your risk of getting any of these medical complications varies greatly depending on your age and pre-existing medical conditions. You must speak to your surgeon about your actual risk. In summary, this is a very successful treatment for lengthening a shortened leg. However, there are important points you need to remember. The leg lengthening process consists of 2 steps. Firstly, an operation to attach a frame and divide the leg. Secondly, a prolonged period, which may last for many months, during which the leg is actually lengthened. Leg lengthening will have a significant impact on your day-to-day activities for a long time. Most people have a good result from surgery. The only consequence of the process are a number of scars on the lengthened leg. However, there are possible complications that can occur. Remember, most complications are treatable and usually will not affect the outcome of your leg lengthening. This means that even if you suffer a complication, you can still have a good result. Thank you for your attention. If you have any further questions about your operation after viewing this educational module, please ask your surgeon.